How long do patients live after pancreatic cancer, palliative surgery? When facing advanced pancreatic cancer, many wonder how long they might live after undergoing palliative surgery. These procedures are mainly aimed at easing symptoms rather than curing the disease. Most patients who have palliative surgery, like a bypass to unblock the stomach or bile ducts, tend to live for a limited time, often measured in months rather than years. Typically, the median survival after palliative surgery is around 2 to 6 months. This means that half of the patients live less than this time, and half live longer. Several factors influence this outlook. For example, if the cancer has spread to other parts of the body, survival tends to be shorter. Poorly differentiated tumors, severe symptoms before surgery, and lack of prior biliary stenting can also predict a shorter lifespan. Patients without these risk factors may have a slightly better chance of living beyond 6 months. Surgical procedures like gastrojejunostomy, which creates a new connection between the stomach and small intestine, are usually recommended if doctors expect the patient to live more than 2 months. This surgery helps prevent food from getting stuck and relieves symptoms of gastric outlet obstruction. However, it can sometimes cause delayed gastric emptying, which may extend recovery time. For patients with a very limited life expectancy of less than 2 months, less invasive options like endoscopic stenting might be preferred. Stenting involves placing a tube to keep the bile duct or stomach open, which can be done quickly and with less recovery time. But it might need to be replaced or reinserted over time. It is important to remember that the overall prognosis for pancreatic cancer remains poor. The 5-year survival rate is very low, around 7%. For those with metastatic disease, which is common in advanced cases, median survival is often just a few months. When chemotherapy is added to palliative care, survival can sometimes be extended slightly, with some patients living around 5 months, compared to 3 or 4 months with surgery alone or no treatment. In summary, most patients who undergo palliative surgery for pancreatic cancer live only a few months afterward. The goal of these procedures is to improve quality of life by relieving symptoms like pain, nausea, or blockage, rather than significantly extending survival. Every patient's situation is unique, so treatment plans should always be personalized. It's essential to discuss expectations and options with healthcare professionals to make the best choices based on individual health and disease stage.